everybody, it's Heather Summers. I'm sorry we're a little late in getting going on our Facebook Live. I'm having to do it off of my phone because my computer will not connect. We are in the middle of moving, as you can see from some of those moving boxes. I'm not sure if that's what the problem is, but I wanted to be able to reach out and to say hello, and I'm holding this up. I know it's kind of a pain to watch, but it's the best we can do today. So we're learning all to do the best we can. So I wanted to talk to you briefly about what's going on with COVID, to see if you had any questions. A few people have emailed in on questions that they had specifically, and sort of give you an update of where we are. So as if you don't know who I am, my name is Heather Summers. I am the senator from the 18th District, and the last 3 weeks, I understand, have been extremely stressful for everybody. It's new territory. It's something that our country and our state have not experienced before. And I just want everyone to know we're all in this together. This is new for all of us, and we will get through this. There have been trying times in history, and I want to say it's been humbling to see how our community has come together in such a difficult time. And the outpouring of support and volunteerism and a willingness to help is really something that we should be proud of, not only as the 18th District, but as Americans. Once again, America rises to the top, as it always does, and its helping hand and its care for each other. So I want you to know that even though we are not in the legislature, we are working tirelessly, or I am. I'm on the Public Health Committee and also the Public Health Emergency Committee, and it really has been nonstop, 24/7, trying to do whatever we can to keep our citizens safe, our medical staff as well equipped as we possibly can, to make sure we slow the curve of this pandemic virus. And Eastern Connecticut has done very well. You can see how the virus is moving, though, from New York, from the south, up the coast. So it's important that we stay vigilant. We continue to do what we're doing here in Eastern Connecticut. And I can give you an update on where we are as far as COVID. Yesterday, we had just shy of 5,000 cases. Those are cases that have been identified as positive in the state of Connecticut. We've had 131 deaths. We have about just a little over 900 patients hospitalized because of COVID. So it's very important that we continue this social distancing. I know social distancing is difficult. It's difficult for me to not see my parents, to not be able to see my older children. It's almost against our human nature. We are social beings. We're used to gathering and socializing, and we're going to have to use technology to be able to do that. There have been some very creative things I've seen on Facebook, people having virtual, chat time and a cocktail. The teachers have been amazing, the way they use Zoom to get their classes together and to bring people together, although not physically. Emotionally, we can connect these other ways, which is so important. If you know somebody who is home and self-isolating and lonely, reach out to them, but via technology if you can, or do something old-fashioned and pick up the telephone and call them. It's really important that we connect to those who, maybe are not as savvy with technology as some of us think we are. I do not think I'm savvy with technology, by the way, or just don't have access to it. Again, that's why social distancing is so important. We've heard, we want to stay 6 feet away. I was suggesting farther away if you can, but a minimum of 6 feet. We know now that the virus is spread not only from sneezing, but really from breathing on somebody, from talking. So stay home. That is the message. Stay home as much as you possibly can. If you have to go to the grocery store, try to wear a mask. The CDC has just issued a guideline that all citizens should be wearing a mask when they go out. Not necessarily for your own protection, but for protecting other people if you happen to be somebody coming or carrying the virus. And I think that's important. There are masks that you can use that are homemade. We've heard the president say that you can use a scarf. I think that we should try to do the homemade masks personally and cover your face when you're out. The other thing that I've noticed with the mask that I've been wearing, which is a homemade mask, is it really helps you not touch your face. You don't realize how often you touch your face until you start counting how many times you touch your face. And having a mask on it really helps you not do that. So that's something also, because we know the virus is so contagious, can really make a difference. Make sure you use your hand sanitizer. And if you can find the Clorox wipes, wipe down your doorknobs, your countertops, everything that you use frequently. I know that I've been doing that. If I have to go to the grocery store, I'm using a Clorox bleach wipe to wipe down the cart. Then I use that to hold on to the cart. When I leave, the grocery stores now are reusing, I shouldn't say reusing, that's not the proper word. The grocery stores now are issuing plastic bags. We've lifted the plastic bag ban because of sanitation. If you still want to use your own bag, you can, but please wash it in hot soapy water, because the bags can be a carrier just like anything else if you're not washing them down. So if you go to the grocery store, because you have to, they will issue everything in a plastic bag. When you get home, if you're pumping gas, make sure you use a glove or use your Clorox bleach wipe to hold the handle. That's something that people don't think about. And once you start to get in the routine, it comes pretty easy. You continue to behave in that manner, or look for things that we probably wouldn't have looked of 4 months ago. I know people miss your friends. I know people miss your family, but it's really, really important. The best thing we can do for not only ourselves, but each other, our whole community, as a broader look forward and to stop the progression of this disease, is to stay home. I wanted to move on to some of the things that are needed in the state of Connecticut. I know that now that we have time at home, or we're forced to stay home and social distance, a lot of people have time, so they have time to ask questions. One of the things that Connecticut needs is volunteers. If you are a former medical person or has any medical training, if you are a nurse, a CNA, an MD, a PA, a respiratory therapist, someone who was an EMS provider, I'm urging you to please go on to ctresponds.ct.gov. I will put all of this information on my website after this is over. We are in desperate need of medical volunteers. So if you know someone, please make sure you mention it to them. It is something that helps provide our current medical providers some relief. And we also need volunteers at our food pantries. Many of our food pantries and soup kitchens, they rely on volunteers to make sure that they can assist in the community. And because we're staying home and some folks are at a higher risk that are typically volunteering, we're looking for new volunteers. And I will make sure that that information is up on my website also. You can volunteer at your emergency response team in your local town. And once you take an online class through FEMA, your town has the ability to certify you. Again, I will put all that information up on the website. If somebody is looking for opportunities to donate, there are many opportunities to be able to donate different things throughout the community. I'll just mention a few of them. Medical supplies for personal protective equipment, masks, helmets, goggles, garments, equipment designed to protect the wearer from bodily infection. I will put that up where you can donate those items. The items need to be unused and the boxes can't be open, and they shouldn't be expired if you're going to volunteer to donate those items. There's also a great need for blood donation. Again, that's down because of the unprecedented number of blood drive cancellations that we've had to do because, again, we can't congregate during this coronavirus outbreak. We definitely are low on blood. So if you're interested, you can contact the Red Cross online. I know some of you that are universal donors, there's a great need for your help. So if you are able and willing, blood donations save lives. So we would love to have you be able to go ahead and donate blood. And you can, contact the Red Cross directly. It's 1-800-RED Cross. I'm going to put all this information I'm giving you up on the website afterwards. There's also, if you're somebody that wants to make a monetary donation, I would suggest looking for a really reputable nonprofit to donate to, like the United Way. The Connecticut COVID Response Fund is another great organization that you could donate to. There's many food pantries. There's the Pawcatuck Neighborhood Center. There is the Gemma Moran Food Bank in New London. Those are all really, reputable organizations that you can make a monetary donation if you are so inclined. So if you have any questions concerning what I've just kind of gone over, please make sure you can reach out here. I'm looking to see if anybody's asking questions. I want to say hi to everybody watching. There's a lot of you watching. Hi, Beverly. Hi, Joanne. Feel free to send us a question. We did have a question come in last night on if you are using a homemade I would call it a homemade face mask, how do you clean it? My husband is on the front lines at the hospital, and I can tell you what we do when he comes home. When he comes home, he's now wearing scrubs every day. He'll come home and he changes don't tell anybody for the neighbors, but he'll change in the backyard. He'll take his scrubs off with his jacket and he puts it inside a plastic bag. When he brings it in the house, we go right upstairs to the washing machine and it immediately goes in the hot, soapy cycle. We have actually a cycle that says sanitize, and we run it through immediately. So if you have a face mask that you have used outside, I would suggest washing it when you come home for the day. And if you feel that you have some type of exposure, put it in a plastic bag, bring it through your house, go upstairs, put it right in your wash. Hot, soapy water with bleach is the key. So I hope that answers the question. I wanted to also touch base on unemployment. I know that that's a huge issue. I want you to know that we hear you. I hear you. As a former small business person, I understand how hard it is, especially if you're the owner. I personally am on the phone constantly trying to move the message up that, small businesses can't afford to wait. People that are unemployed can't wait 5 weeks for the state of Connecticut to process paperwork. But they are overwhelmed with the amount of people applying for unemployment. They have information that's up that I will again put the website out for you so that you can go ahead and look at where you are in the status. There's been many things happened. The president signed into law a Family First Corona Response Act that expands the Family and Medical Leave Act and paid sick leave. Those two acts became effective April 2nd, and they are set to sunset on December 31st. What this does is amends the federal law only. It's applicable to employers of 500 or above, and it requires employers to provide 12 weeks of job protected leave for eligible employees. And it's very distinct from the Connecticut paid sick leave law, which remains unchanged. I'm going to go through some of the other things. There are some federal assistance grants that are confusing, that are paperwork intense, but they are worth going through the process. The first one is an SBA loan, which is federal assistance, and there's Paycheck Protection, which has nearly $350 billion of funding. And that provides small businesses and nonprofits and other entities zero loans for up to $10 million on an average monthly payroll cost. It also gives small businesses up to 8 weeks of average payroll, mortgage interest, and utility payments that can be forgiven if a business retains its employees at their current salary levels. So those are something that is important to look at. And then any principal and interest payments can be deferred for a year under the SBA borrower. Fees are waived. We also have SBA loans here in the state of Connecticut. These would cover all loan payments for its existing SBA borrowers, including premiums, interest, fees for up to 6 months. The loan amount would be based on monthly payments. All these things are very intensive as far as applications, but they're worth doing. I always tell everybody who calls me, go ahead and apply. The worst thing that could happen is that you are not accepted for some reason. We will try to help you through the process, but take advantage of whatever you can in these difficult times. As small business, we need you to survive. We want you to survive. We want your future to be successful. We want your employees to continue. And if this can help bridge that, please take advantage of it. We have also, there's emergency injury grants that has to do with small nonprofits. The IRS will be posting tax credits. There's payroll taxes that are now been deferred. There's income tax that has been deferred here. Business tax, sales tax here in the state of Connecticut is deferred for March and April. There's disaster loans. There's a lot of information here that I'm trying to blow through so I don't take up all your time this afternoon. I'm going to put it all on the website because I don't want to bog you down with all those items. But some of the things I think are important for all of us are tax filing deadlines. The federal government is giving taxpayers a 3-month reprieve to pay income taxes that they owe for 2019. So if you owed, you get an extra 90 days to make your tax payments. The Connecticut Department of Revenue Services has extended the filing deadlines for annual state business returns, and I'll put more information on the website just so you are clear on that, because there's a lot of different deadlines, whether you are state or federal. I'll just give you an example. The Connecticut Department of Revenue Services is extending the filing and payment deadline for personal income tax 90 days. So your income tax for the Connecticut DRS, so Connecticut Taxman, is not going to be due in April. It's going to be due in July. The extension also applies to Connecticut estimated tax income payments for the first quarter of 2020. So if you're someone who has to estimate your taxes because you're self-employed or because you earn over what the threshold is, those are also deferred for the first quarter. And I will put all that information up again on the website. Let's see what I'm going to go through here. That's probably as much information as you want to hear on all the taxes and the deadlines. Somebody has asked here about electric boat employees, and I wanted to let you know what's happening there. I have been in contact with the legislative liaison, who is someone who works directly with the president there. It's difficult because electric boat, because they're in defense, is considered an essential employer, meaning that people working there are essential employees. They are not non-essential. Electric boat has told me specifically in writing that they are trying to do everything they can to make sure that their employees are safe. They have allowed for flexibility of shifts depending on the schedules of the folks that are working there, because now many people are home having to take care of their children at home and school their children at home. They have indicated that employees can take up to 80 hours of paid time off, and they can actually go into the negative 80 hours of paid time off if they are feeling uncomfortable at work. They also have tried to tell me that if somebody is very uncomfortable, they should talk to their supervisor, and they will try to make as many accommodations as possible for the employees working there. However, they are considered essential workers. We have had 3 positive results for people that are working or employed at Electric Boat, and they are home now and self-isolating and under self-quarantine. And I will continue to keep you updated as we move forward. I've had a few questions on why is it that everyone can't get tested, or why shouldn't everyone get tested for the virus? The simple answer is, number one, the FDA had not cleared a fast test. I know people like to place blame here or there, but the FDA has to clear all these tests. So they just have recently cleared a fast, rapid test. If you were tested positive, or if you were tested for the virus without symptoms and it was negative, the only thing you would be learning is that you were not positive for the virus at that moment in time. So the tests have been truly reserved for those who are showing true symptoms, are having difficulty breathing, are running the high fever, and really are people that could possibly need to be hospitalized. Because if you are positive, there is nothing they really can do for you at this point, unless you're at the point where you need to be in a hospital. In the hospital, they can put you on a ventilator, and they can give you fluids, and they can try some of the experimental drug therapies that are out there. However, most people recover at home. And therefore, testing everybody really only tells you what's happening at this moment in time. What we really need, and what we're hearing will be coming shortly, is what we call an antibody test. And that test should be normally a blood test. That would tell you if you've been exposed to the virus and if you have produced antibodies. That would tell us who is almost on some level immune to the virus and who is not. That would be much more helpful than testing everybody, because the test is only good for that moment in time. I hope that makes sense. The other thing that we have been asked is, well, why are the hospitals quiet? The hospitals are quiet now. That's what we use, or that's the term we use in medicine, like the hospitals are not filled. So they're quiet. The reason that they are is because they've stopped pretty much all elective surgery. They don't want you coming into the ER unless you really truly need to. So we're trying to treat people through telehealth, because we want to keep the population as low as we can so that the beds are appropriately being used for those who are the most sick. So if somebody comes in to the hospital and they are sick with the virus and they take up an ICU bed, they're not getting out in 2 days. So that ICU bed is then offline. Many of our hospitals have a limited number of ICU beds. So what we all do by staying home and stopping the transmission of the virus is making those ICU beds go to the people that need them the most, and that the hospitals do not become overwhelmed so that they cannot handle the amount of sick people at one time. People will still get exposed. We will still have people that get very sick, but over a longer period of time where we have enough equipment, we have enough beds so that they can handle the rate of infection, if that makes sense. And I'm looking here. Somebody's asking my thoughts on what we are doing to protect the First Amendment rights of churches to meet. And let me see, I'm sorry. And the unconstitutionality of the government limits on the number of people at church. That's a tough one. And I do believe in our First Amendment rights. However, we have an unprecedented pandemic of a virus. So we have to think about other ways to worship in a way that we can connect. But when we are under emergency orders under the governor, which we are now, that is the law. And if he has said only 10 people can gather, and he is getting his advice from the epidemiologists, then that's what we have to abide by. This is not going to last forever. But if we can abide by these restrictive rules right now, we are estimating, based on the modeling, that the peak for Connecticut will be April 15th, tax day. Funny, ironic. Then we can slower the rate of infection, and we can get back to normal much quicker than we can if we don't take that advice. And we can see what's happened in the hot spots where people were cavalier with social distancing. Eastern Connecticut is doing great. I wanted to let you know, compared to other parts of Connecticut, we really are taking it seriously. We care for others without, actually being in close contact. And you can see that by the rate of infection. Yes, we have less people, but we've had a lot of people come from hot spots to our area that maybe have a second home here or trying to get away from New York, and we've still managed to keep the numbers relatively stable. So if we continue to do the great work that we're doing, we will be in much better shape in a few weeks, and we can look forward to when we can get back to church and when we can get back to gathering in a larger group than we can if our infection rates continue to spike quickly. We can also do Facebook Live worships. I know many of the churches that I've visited, they live stream their services. There's also Zoom, which you can use. I know that's not going to do hundreds and hundreds, but there are other ways for us to be able to come together as a church or another organization without having to be in contact. And again, this is for a limited period of time. The stronger we are in social distancing now, the less time that we will have to continue to social distance. So I am looking here. Some people say, I'm hearing people talking about locking down until 100% cure comes out. I'm not sure what that means specifically about 100% locking down here. Let me see. Sorry. Blah, blah, blah. Patients, we are winners. Okay. I'm not really exactly sure about what 100% lockdown is, but what we should be doing, and it's hard for me because I forget, I can't go do that. If you can order your groceries online, order them online and just go pick them up. If you do go to the grocery store, you have to social distance. There's no need to go out and buy hundreds of rolls of toilet paper or all the chicken or all the hamburger meat. We are continuing to get supplies. One of the issues we had in the beginning was everyone was fearful, so they went and they bought much more than they probably needed. And therefore, the grocery stores, they have an order system that they're ordering on a projected volume. The volume went way up. It took a little longer to get the stuff in stock. And there'll be plenty of supplies. They're coming. There's no need to buy more than you need. But if you do go to the grocery store, you can do things online. I know many pharmacies are delivering medications for patients so they don't have to actually get in the car and go to CVS or go to Walgreens to pick up their prescriptions. If you live near somebody who's elderly and can't get out, we've seen some great acts of kindness, I will say, where people will get in their car and they will drive around and they will toot their horn and they will shout out to their neighbors. What we've started in our community here is we have every night at 9, I think it's 7 o'clock, people put a different stuffed animal in the window in a funny position. And if people are driving in their car, they can see them. They also have an amazing thing in Stonington at 8 o'clock every night. They ring bells. That's something that is very powerful, I believe. Some of the church bells are ringing. If you're just in your house, you can hear the bells ringing. I think that we should start something in Eastern Connecticut at a certain time to clap for our first responders, our medical staff, our nurses that are working under really difficult conditions and doing an amazing job. So there are different ways we can reach out. We've seen I can't think of the word, not healthcare, like a child care provider, a nanny who can't see the child she cares for, come by and just hold a sign saying, I miss you, grandparents and, grandchildren doing the same thing. So I think this whole process has really, for me anyway, given me time to pause to realize how fortunate we are when we have family that lives close, and how sometimes we take it for advantage, or that you can just take it for granted that we have the advantage of just being able to run over and see our parents or see our sister or our children. And it really makes you think how lucky we are in some level. But there are other ways to connect, as we've talked about, that don't involve actually being physically close. So, okay, I have Mary Gothier here saying, okay, let's start tonight at 7 p.m., 3 cheers for first frontline workers. So tonight we're going to start at 7 p.m. We're going to go outside or stand in our doorway and clap 3 cheers for our first responders starting tonight in the 18th district. So hopefully we can all hear that roar across the 18th district. So I have here, hello, I'm the owner of, I got the barbershop in Groton. Do you know of any local lenders that are actively taking PPP applications? We certainly can talk offline. Why don't you private message me, Danny, and we'll try to get you hooked up. So I don't know if anybody else has any questions. I'm trying to send you as much information as I have. I want to make sure that you have it. If you haven't signed up, if you sign up for my newsletter at Heather Summers, so it would be heather.summers@cga.ct.gov, then you would be able to get my newsletter. And if you get my newsletter, you certainly can, you will get emails that will give you an update on everything that's happening in the state of Connecticut concerning COVID. If you have questions, feel free to email me. You can reach out to my office. Even though we're not physically there, we are taking the calls and we will call you back. There are some really interesting things that have come up. You know, everybody has an issue sometimes that doesn't fit perfectly into these little boxes that we have created as far as solutions. So if you have something unique that you need help with, please reach out. We might not have the answer right away, but we certainly will get back to you and try to answer it as quickly and as as expediently as possible. We've had issues with that. I can just mention some things that have come up concerning COVID, like a divorced couple where they're supposed to be moving children back and forth, but one of the parents ends up being positive for COVID. How do we handle those things? The other thing that is extremely helpful, if you have time, is your local health districts are a wealth of information. There's the Uncas Health District, and we have Ledge Light down here in the south. Both of those websites are amazing, and I want to do a shout out to their directors because they are working so hard to keep everybody safe. And they're the experts. They're doing an amazing job. And I want to thank them personally for all the work that they're doing, because I know just yesterday I was on the phone with one of them asking for advice on a particular situation. So we really appreciate everything that you're doing at this time. So I'm getting another question. Are state funds available to house the homeless? We are working on places to help those who are homeless, those who are homeless that have COVID. You have heard some information about, let's talk about nursing home patients, that they want to put a special COVID nursing home together. That sounds like something that people have a real hard time with, and I just want to explain what that really means. When you have somebody who's in the hospital and they're being discharged, many times they're discharged because they're not ready to go home yet, but they're ready to go home from the hospital to something that we call the skilled nursing facility. And a skilled nursing facility is what we used to call a nursing home. And they are skilled. They have nurses. They can provide the kind of care that many need when they're first discharged from the hospital. So we all know what happened in Washington when we had a nursing home where everybody got sick from COVID. Nursing homes or skilled nursing facilities, everybody's in tight quarters. The state of Connecticut, unfortunately, as too with hospitals, has really, under the last few administrations, cut significant resources for these facilities. And so now they are on budgets that are below anything that's acceptable, quite frankly. Many of our skilled nursing facilities were barely able to keep their doors open even before COVID. So they want to ensure that a patient that's being discharged from the hospital, because we know we have COVID patients in the hospital, has not been exposed. And that makes sense. That's a safe thing. So the past few weeks, I have been lobbying to the governor's office through our leaders that when we have a patient who's discharged from the hospital, we were testing them for COVID, using up that test to make sure the skilled nursing facility felt comfortable taking that patient in. What we've decided to do since then is reopen some of the skilled nursing facilities that were closed, partly because of funding and partly because of resources. And if there's a patient that maybe have been exposed to this virus in the hospital and is being discharged, can go to this facility. So those that are remaining at the other skilled nursing facility have a level of safety. And that's why we're doing this. I just wanted to make sure that was clear. The other thing that we're trying to do is we are trying to ensure that clinicians, in many fields, whether it be from a mental health therapist to it's somebody who is a primary care doctor, an APRN, they have the ability to still treat patients without the patient actually going physically to see the physician. And we're doing this because, again, physicians, APRNs, therapists, we have to social distance ourselves. So we have been able to lobby Medicaid, and they are now reimbursing, because telehealth in the state of Connecticut previously was really only through Skype on the computer. So not everybody has the ability to get on Skype. So we have now been able to expand that to being able to visit with a patient on the phone, just talking to them, which is perfect for therapy, or to be able to expand it so you could FaceTime your clinician, and the clinician can offer that service, and the clinician can also get reimbursed. So it's providing two things: an ability for the patients to continue to seek the care that they need, a continuum of care, and also to allow the provider to continue the service. So there's been a lot of things that we've been working on that don't, make the headlines, they don't make the newspaper, but they are very important for continued care. I have been talking a long time, so I am trying to answer as many questions as we can as I'm seeing come up. I wanted to assure everyone that although we hear on the news, which is very not comforting, quite frankly. I mean, I watch it and it's, we hear each day the death toll, etc. I want to keep it in perspective that most of the people that are exposed to this virus and catch it recover. But we need to do our part and make sure that we don't expose the most vulnerable who do not recover. So social distancing, staying home is the new cool thing to do. If there's one thing that you can do to help your fellow citizen, your own family, your mother, your father, your children, is stay home. It used to be, when I was young, going out Friday night was super cool. We'd go out at 8 o'clock at night. We'd stay out. Now it's really cool to stay home. So stay home. You can reach out to your friends by FaceTime, by Zoom, call them on the phone, the old-fashioned way, call them up on the phone and just talk to them. Spend time with your family. Spend time reading a good book, getting a new Netflix subscription. Disney's going to be streaming some movies, I understand, rather than opening them up in the movie theater. I know this is difficult, but we all have to stay together. And our community is strong. We are stronger together than we are individually, and we're all doing a great job. We just have to keep it up. So I want to thank you for your time listening to me. I hope I answered your questions. Oh, I got another one. Is there any talk about making sure insurance companies are reimbursing for a reasonable amount of telehealth visits? I've heard of companies reimbursing as little as $4 for a visit. Yes, Rebecca, that's something that we're working on. I just got confirmation from the insurers that they will be reimbursing for telehealth at a reasonable rate. If you hear anything different, please let me know. That's one thing that I did get in writing from them. Now we just have to make sure on the other side, if the insurance companies are going to be paying at a rate that is comparable to a non-telehealth visit. So they should be paying a clinician the same rate that they would be paying them if the clinician was seeing the patient in person. If we're here, that's not happening, I need to know about it. And secondly, we want to make sure that if the insurance companies are reimbursing the hospital at that rate, that the hospitals are reimbursing the clinicians at the rate. I've also heard some funny business there. We want to make sure that is, that the hospital's not getting reimbursed at a rate of X, and then they're cutting it down to a quarter for the clinicians. That would not be good in these times. This is a difficult time for everybody. We want to make sure that we're all doing the best we can and the right thing, and nobody should be price gouging. Nobody should be trying to make extreme profit. This is not about politics. This is not about anything other than public health here in the state of Connecticut, in our country, or it should be, and making sure we preserve lives. So if anybody has any additional questions after we sign off, please feel free again to email me, to text me, and sign up for my newsletter so that you can get the latest information. I'm going to also ask for people to be patient. Because people are home, Jared and I normally get maybe like 400 to 500 emails a day. Now we're getting thousands of emails, and we try to answer all of them, but it may take us a little time, and sometimes we don't have all of the answers immediately. One other thing, I keep saying that, one other thing. There's a lot of other things. I want to do a shout out to our police and first responders. Because everyone is home, we see a rise in domestic violence because everyone is home, and sometimes people are not used to being together for this long under stressful conditions. There's been a lot of unusual police calls. Our policemen and women are out in the front lines, as are our firefighters and our EMS providers. If you see them, give them a honk of thanks, because they've done an amazing job and dealing with some really difficult conditions and time. And I can't thank them enough for everything that they do to keep us safe. And sometimes they're dealing with people that are coming from other areas. They're not even coming from the state of Connecticut, but they're coming into Connecticut, and then they're having to deal with some really tough situations. So I want to thank them, because sometimes we forget them. So I hope you can enjoy the rest of your day. It's freezing out. I was outside for just a little bit in my own yard, and I hope you can join us tonight for story time. Some people have asked me why I'm doing that, and the reason I'm doing that is I was talking to some moms who, they are home now with their children, and it's difficult. Some of them that have a couple at the same time. Not only are you home from your own job or trying to work from home, but you're trying to also school your children at the same time. And they had said, God, I could just use a break. So I thought, hey, at 8:00 every night, why don't we do a story time online? Just read to the children, and I can be your story time babysitter for 15 or 20 minutes to read a couple stories to your kids so you can sit down and just take a break. I missed last night because our computer wasn't working, because we're in the middle of a move in the middle of this, but we are going to continue this. And if you have any suggestions, please send them along. And I want to thank all of you for tuning in tonight or this afternoon. And I want to thank you for your support. This has been a difficult time as a state senator to try to be as available as you can, but also abide by the rules that we are setting for everyone else. And I want to make sure everyone knows we're working as hard as we can on public health to make sure everybody stays safe. And we appreciate the generosity, the coming together of Connecticut, and especially Eastern Connecticut that I represent. I am humbled to be able to represent such amazing people in such difficult times. So I wanted to give you that update, and I hope you stay safe, stay well, stay home, stay covered, stay under a mask when you go out, and I'll be thinking of all of you. And again, reach out whenever you need to, and God bless. And I'm going to say goodbye now. Goodbye, and I hope you enjoy the rest of your afternoon.